It looks like Chris and Chris. Go ahead.
Oh, hey, Greg. Hey, Sam. Hi. Looks like you're home now, right?
Yeah.
Yes. Good. Glad you can do some relaxation. Been traveling a lot.
Yeah.
Hey, Greg. One of my clients was rushed to the hospital emergency room. She had some sepsis going on. She's been having chemo treatments. So the body is really struggling with the medication for the infection. Wondering what I can do on my end to support that.
Where's the infection? Do we know?
The blood.
Blood.
Yeah.
So what would you say she was having what?
She's a cancer patient as well.
But what did you say before that? She went to the hospital for
sepsis.
Sorry, it was
sepsis.
Oh, sepsis.
Yeah. Yeah. So I've been doing the blood purification protocol and severe infection for pH. Not sure if there's anything we can do in terms of oils at this point. She's still in the hospital.
Yeah. With something like that, I mean, she's under doctor's care, so they've got things that are in play, but sometimes still we can try to augment approaches. And I would say any form of time would be really good here. Like, benchmark would probably be the best, but other forms would be okay, just whatever you have. Maybe at first, just have her do a lot of, I'm thinking this out. Probably at first just do a lot of long inhalations, but then eventually start taking it internally.
Okay.
Just to strengthen the immune system and give the body a little bit more strength.
Okay.
I would say at some point you need to clean the blood up. That would probably be Greenland moss. Might be able to do it with black cumin, but I would probably go for the Greenland moss.
Okay.
But I would say probably not until she's a bit more stable. It's not that it would make her you don't want to send a person in like a detox.
Right.
When they're in their middle of a crisis, and I don't think it would, but you never know. You know what I mean? So, the chronic infection, cleansing the blood, super good approach. I mean, that just really intensely clean the blood, especially the organs, the liver, kidneys, lungs, the spleen. Even if you don't do the other portions of that protocol, really go intense on that. And just have her inhale a bunch of time. Yeah. It'll make the body stronger. And, the thing with time when there's immune type issues is as far as like an herbal or an oil approach to issues that are immune related, time can be a magic bullet sometimes. Like, just when nothing else is working, or, you just start giving them dosages of time, and it really can help pull a person out. It's strengthening, it stimulates the immune system, it helps to regulate circulation. The issue here is the person's just in a very fragile state. It's not just the sepsis, it's the chemo and the radiation if they're doing that, and then going through cancer. And so, in situations like that, It could also be really severe injuries. Sometimes you start off with just kind of spoon feeding the person for a little bit, like just little small dosages. As they start to get a little bit stronger, you can increase treatment or dosages and things like that. But even with the energy work, sometimes you can't energize that much. You can't clean that much.
Just cleaning, right?
Yeah.
Oh, okay.
I mean, eventually you want to be able to pretty intensely energize those organs, but they probably can't handle a lot of that right off the bat. And so, you energize for just a little tiny bit and then let it assimilate, and then a little bit more and then let it assimilate. And so everything you do is going to have to be real super gentle, real super gentle for a while.
Okay.
Until she stabilizes a little bit. Yeah.
Mm-hmm. Okay.
What kind of cancer does she have? I'm just curious.
Liver. There's something in the liver. Yeah, I think it's pancreas, I think. Yeah.
Oh, pancreatic, yeah. So there's a lot of pain involved as well.
I think there was a spot in her pancreas, but I think that was mitigated.
Okay.
Yeah.
So let's have her just try that for a little bit, and then maybe in a few days or so we can talk about it some more. But that would be the start.
Okay. Thank you so much.
As far as pH, do even just like a little bit of white in the palms and soles of the feet.
Got it.
Just get her body used to assimilating some energy, just little tiny bits at a time.
Okay.
It will make her body stronger, and at some point the body will start absorbing more prana. That way, whenever you energize the hands and the feet, it stimulates the body to start absorbing more.
Got it.
It will make her just naturally start absorb more prana.
I see. Okay.
Yeah.
Thank you. Can I ask a couple more questions?
Yeah.
So Chris's surgery's tomorrow.
Oh, yay.
Yeah. So he's so excited.
Finally, that pain's gonna be gone finally.
Yes, so exciting, right? In terms of oils, aside from the ones we have been using, like with joint pain.
Yeah. We were on the road. We're going to get you a little post-surgery packet too.
Yeah, that's exactly.
Yeah. So we'll get it to you.
Say that again.
We were on the road, but we're going to get a post-surgery packet out to you. And you still can't use it for, probably about a week or so. And so as soon as you get it, you still might need to wait a day or two, but we'll get you a kit out. So don't worry about it. We'll send you all what you need.
Oh, thank you. So did you say don't use it for the first week?
The only thing that I would probably do right off the bat after surgery is take some black cumin internally, and then either galbanum internally or galbanum on the wrist. And for probably 4 or 5 days. Other than that, I just let the body acclimate for a little bit. Got it. Yeah. And then as the wound starts to close and everything, then there's some things that I'm going to have you do.
Thank you. And then for pH, would it be more
green, orange, red? Yeah, like on
the one. Okay.
Yeah.
And then some psychotherapy,
right? Stress management in these situations, even though he's pretty chill about it all, still the body goes through a little bit of a stress because of the surgery. So stress and or trauma, just because it's still an incision and
right.
You could always do that. Yeah.
Okay.
I would actually do it more on the joints than I would on the chakras, because it's not psychological, it's more your physiology. And so it's a way to diminish the reaction from the body. Yeah.
So EV on the joints.
Mm-hmm.
Okay. Interesting. Wow. Yeah. Thank you so much.
Yeah,
one last one. So when we went to the hospital to meet with the surgical team, we came home and strange things were happening in the house. So I think we brought something home. In terms of protection for using oils, when we're in that type of environment, when we got home, burnt the incense in all of the rooms. I did the camphor and then the Glory of Lebanon. But in terms of oils for protection, being in that environment, what can we use topically?
You can use a couple of different ones. You can use the protection blend. You could also just use sage, or you could use Palo Santo.
How about the armor? Does that help with?
That would help more with the immune system. Like that's
immune system. Okay, got it.
But like this is just elementals and contamination, and the sage or Palo Santo, chocolate root cleanser would also work.
Okay, I have that in my purse all the time.
Yeah.
Okay, cool. Thank you so much, Greg and Sam.
Perfect. Yeah, let us know how it goes. Like when he's out of surgery, let us know.
I will. Thank you again. Bye-bye.
And go ahead, Sandra.
Hey, Sandra.
Hi, Greg. If I may, I have 2 questions for you today. The first one, I'll start with what I think is the easier one. My son, who's not quite 50, his doctor tells him that he has full body inflammation, and it kind of runs in my family. And I was wondering, when I looked through all my notes for inflammation, I wasn't really quite sure which one would be the most appropriate.
So, is there a particular health issue that's happening right now, or is
not yet? But I'm kind of afraid. I think he does probably have high blood pressure. He has a high stress job, and heart disease runs in my family, and so I'm just a little concerned that if the inflammation continues, that will have. And he's promised me he would take at least one oil.
I like that he's qualified it in just like maybe one. Like at least
just to shut them up.
Right. So the thing that would be really helpful for when there's a lot of body inflammation, you have some choices. My first go-to one is black cumin. Black cumin, really super good anti-inflammatory. It's good for cleaning up the body. It stimulates lymphatic function, which if he has a lot of inflammation, the lymphatic system is either working overtime to process it, or maybe a little bit like stagnant, like, it's like a little bit gunked up, especially the lymph nodes and things like that. And so black cumin can be really quite helpful here. Turmeric would also be another one that would be on the list, but I would probably go black cumin myself.
Okay.
And then like topically, any of the oils that are real dark blue, like German chamomile, yarrow, things like that. You can mix it into like witch hazel or alcohol, and then shake it up really good, because then it'll separate a little bit. So shake it up really good, and then just rub it all over the body. That will greatly reduce inflammation, actually relatively quickly. It's very soothing to the sensory nerves when there's a lot of inflammation. The byproduct of it is the sensory nerves get overstimulated, and the person themselves starts to get overstimulated because of that. And so I made a blend about, I don't know, maybe 3 or 4 weeks ago, that what we call it, blue healer, and it's just all the blue oils. They have the dark blue is caused by a molecule called azulene, and it's very super anti-inflammatory. And so you see it in anything that's got a blue tint to it, or dark blue, that's got decent amount of azulene in it. And so we just basically combined all of them with some helichrysum and things, and that's what it was made for, is to put on topically to soothe the sensory nerves and reduce inflammation. And so, I'd keep it really simple, especially since he's, willing to do a little bit, but not do something super crazy. Like 3 or 4 drops black cumin every day, like in water, but he could even just go direct on his tongue. It's a little thick, it comes out a little slow, but you can do that. And then if he'd be willing to do the topical thing, it would be very soothing. And if he has aches and pains, it would take some of the pain out. But if you had to choose one, I'd go black cumin.
Okay, great. Thank you.
Yeah, you're so welcome.
My second question is a very good friend. His wife is a client of mine. He's in his early 70s, extremely active, but for some reason, his lymphocyte count keeps going down. If, say, the bottom of the normal count would be 25, his has gone down in the last year to 13. Now, his doctor is on leave right now, and he doesn't want to go to any other doctor, but his wife is really concerned. And I don't know enough about the lymphocyte count to know if this is serious or if it's just something he should be watching.
It's probably a little bit serious.
Yeah, I did scan. He has a problem with the bone marrow. He doesn't seem to have a problem with the thymus. So it sounds like kind of maybe, well, I hope not a blood cancer, but.
It could be several things. Sometimes you might see something like this with intense viruses as well.
He says he hasn't had COVID,
Okay.
and he hasn't really been sick.
It would probably be even a stronger virus than COVID. Like it would be like really nasty viruses. And so, does he have a lot of?
That he's, sorry, says that his energy, he's usually an energetic guy, and it's been going down, down, down.
Yeah.
So
this is what I would do. Like, you know, we're not trying to diagnose it or know anything. I mean, really with the information that we have and that we just know that it's lymphocytes and everything, is I would do a lot of lymphatic work. You know, lymphatic blend, Bayloral for the lymph nodes. One of the things that I would question, not that this is a cause of it, but we'd want to try to keep things moving with the lymphatic system as much as possible, is how much is he urinating? Like, is he urinating regular? Is he not urinating that much? And so, if so, you know, we'd want to look at kidney function as well.
Okay.
And, maybe ask him that and like shoot us an email and let us know. But basically, with what we know right now, a lot of lymphatic work, just any variation of the lymphatic work, you know.
Bayloral's good for that, isn't it?
Bayloral is good for the lymph nodes. Lymphatic blend, chocolate root cleanser is a lymphatic stimulant. Even the pepper supreme or viscosity is literally about the viscosity of the lymph fluid. And that can be quite helpful, but just start going after the immune function. Let me look something up here real quick. Yeah, I mean, it's sick with what we were talking about. Like, have you focus on Bayloral and like lymphatic blend or CRC, something of that nature, and just go crazy with it. You know, you could put a bunch on the body at once.
Okay.
You know, even the Bayloral, you could even put it on meat, like hit all the joints. And you know, put several drops on each of the joints, you know, unless his skin is reacting. You know, it's a little bit more of you're wanting to try to jumpstart the body to go back into a phase of healing. And so yeah, those lymph nodes don't look good. Let's do this. Do you have Bayloral?
Yes, I do. And
Okay.
I have CRC and I have.
Okay, perfect. And how about lemongrass? Do you have lemongrass?
I do.
Okay, so take some lemongrass and put about 30 drops per ounce, like 25 drops to 30 drops per ounce of either alcohol or witch hazel, and shake it up and have him rub it all over his body.
Okay.
And then follow it up, like when that dries up, you can go through and put the bay laurel on the joints, where they're creased. Maybe just be careful with the armpit, because that might make it sting a little bit, but get it kind of close into the armpit area. Or he can take 2-3 drops, maybe even, let's say 3 drops internally in some water.
Okay. You're talking about bay laurel for that, right?
Yeah, bay laurel. And I would have him do black cumin internally as well.
Okay.
Yeah.
Same 3 drops?
Yeah, 2 to 3 drops. They don't have to be together. You can spread them apart, but.
Okay.
How old is this gentleman?
He's in his early 70s.
Okay. And when's his doctor getting back?
Oh gosh, I think it's going to be about 3 weeks. And, this has been happening over the year. She sent me, she told me what happened. She said a year ago it was 17. She thought that was kind of low. And then it went to 15. And then it went to 13. And the doctor hasn't said a word. And so he assumes it's okay, but she doesn't assume it's okay. And I think
something's up. Let's just say this, we're not going to guess what it is, but something's up.
Yeah, I agree.
Okay. So let's start with these things and see how that helps, and just highly suggest that he get in and see his doctor when his doctor.
Okay. Can I just ask you one more thing?
Of course.
Back to the inflammation. Does Moroccan thyme work for something like a lot? I know it works for autoimmune problems. Would it be a good thing for the body inflammation or not necessarily? Yeah,
it is actually anti-inflammatory. The Moroccan thyme, I use that sometimes as an anti-inflammatory, that especially when it's just kind of non-specific, where how sometimes you just feel inflamed, what I mean? It's just so black cumin would work. Moroccan thyme does work, and the benefit with Moroccan thyme is it does stimulate the function of the thymus, and it helps to regulate the thymus. And so you could use that. You could actually still even use it with black cumin.
Okay.
But usually when I start talking about treatment with somebody, I kind of don't want to overwhelm them with a bunch of things to do, so I kind of pick one. But you could do multiple things, like the Moroccan thyme and the black cumin. Both would be good. And the thing with the thing with Moroccan thyme is it's also really good for low-grade infections that have either been there for a long time or sometimes even get overlooked. It's just enough of an infection to cause a problem, but even sometimes when you go and you get testing done and everything, it doesn't really show up.
Right.
It's just low grade. Moroccan thyme's really good for that. It's really, really good for that. Yeah.
Okay.
Sometimes when somebody has a health issue and it's not responding to normal treatment, and we're not sure is it virus, is it bacterial or whatever, I actually will start rotating them through the different types of thyme. Some of them are very good at treating more viruses, more bacterias. But when you start rotating it, they all have their little personality for it. And so it's a way to have a full spectrum approach. When you blend it together, it still works, but sometimes I like to let them do the thing that they do on their own. And so, if you're really looking at some serious immune type compromise, and we know that it's not autoimmune, you could rotate through the different times. But if you just think it's low grade or if there's inflammation, I mean, inflammation happens. I mean, it's literally actually what the aging process is. The aging process is an inflammatory response. And so by going through and minimizing and reducing the inflammatory response, you actually are slowing down the aging process or the potential for the body to break down. And so anytime that you're kind of in doubt, sometimes like with what is going on, you can always jump to inflammation. You can always jump to inflammation. I mean, it doesn't hurt treating it. And the body usually has some level or degree of inflammation to begin with. And so it just makes everything work a little bit better when the inflammation is reduced. And so it's always a good thing to jump to. And so Moroccan thyme, you know, I take it from time to time, and I do it more for just keeping the thymus regulated, but I usually do it when I'm feeling a little inflamed, you know, be it that it's my back or like a little bit of allergies or, you know, travel and fatigue and just being in, you know, different locations and being out of sorts. You know, I'll come back home or get to a hotel, and I just, you know, I'll kind of go deep on the Moroccan thyme and the benchmark thyme. Mm-hmm. You know, as we were driving home yesterday, we were both like going back and forth between the benchmark time. It's like, okay, now pass it to me, and then going back and forth. But, you know, it's just, it's nice. It's like it strengthens the body. It makes you kind of breathe better, and, you know, gives circulation to the lungs, and boy, it's very strengthening to the thymus. And so, yeah, if in doubt, treat inflammation.
Okay. All right. Thank you so much.
You're so welcome. If for some reason something is like non-responsive, run it by me. Shoot an email or something. Let us know.
I will do that. Thank you.
Yeah.
Yeah. Go ahead, Ralph.
Hey, Ralph.
Greg, piggybacking on the Moroccan thyme, for a thymus issue, how would you do that neat, or would you put that on water?
You could do it neat, but you'll get much quicker effect by taking it internally.
Okay.
Like,
What
so
would the dosage be?
Like 2-3 drops in water.
Okay.
You know? Like a casual dosage is considered 1 to 2 drops, and so I would just step it up just a little bit. But you know, there's been times where we had somebody who was dealing with a serious you know, infection or something, and boy, you know, I think I did 5-6 drops 2 or 3 times in a day.
Okay.
And you know, that's an extreme, but sometimes, you know, they need it, and so 2 or 3 drops is pretty okay. You know, it will reduce inflammation somewhat and keep the thymus strong and actually regulated. You know, that's the thing. The Moroccan thyme will regulate an irregular functioning thymus. You know, sometimes when it becomes hyperreactive or hypervigilant, it starts to actually, the immune system starts attacking the body, which is like the precursor to an autoimmune issue. And it helps nullify that, you know.
Okay.
Sometimes it takes a while, but if it's in the early stages, it can do it actually relatively quick.
Okay. All right.
Yeah.
Number 2.
Sure.
So I enjoyed the abandonment class a couple weeks ago. Thank you.
Oh, good.
What about doubt? Do you have a process for doubt?
Boy, doubt. That's a good one. Let me think about that for a sec. Doubt. Does that happen often, or is it just about a particular thing, or?
It happens often.
Happens often. How about decision making? Like, how's the decision making process? Like, when it comes time to make a decision, is that where the doubt kind of comes up?
Yes.
Yeah. Okay. Okay, so I'll run a couple of things by you, and we'll have to explore it a little bit. Like a lot of times with something like this, I'd like to maybe go a little bit deeper and go, well, why is it there, or this or that. But let's just treat it for what it is at first and see how it responds. And if it doesn't respond, then we'll go deeper on it. But just see what happens with simple treatment. Okay. And so two oils that I would say are your best bets. Yep. One is Litsea cubeba.
How do you spell that?
Litsea, and then new word Cubeba.
Okay.
Litsea cubeba. And then the other one, which is actually a little bit stronger choice, is Palo Santo.
Okay.
Yeah. And you could try putting it on like several drops on the wrist. I would probably lean more towards the Palo Santo, by the way. Okay. I put several drops on the wrist and probably a little bit on the solar plexus, a little bit on the throat.
Okay. So wrist, solar plexus,
and throat.
And okay. Okay.
You could also do a salt bath with it from time to time. Definitely, you can do inhalations with it. I don't know that you even need to follow a pattern. You could probably just inhale it and call it good.
All right.
But I think if you did that, daily for a little bit of time, like within a few days or a week, you probably would notice that the doubt is diminishing.
Okay.
Yeah. Yeah. We can always go deeper on it, but sometimes, you've done like a bunch of the work that's underneath, and sometimes it still just needs to be mopped up a little bit more on the surface. And let's just start with that. Okay. Let's just mop it up and see what happens, and then we'll go from there.
Okay. And excellent.
So, yeah. Tendency to be super critical of yourself, or just not? Yeah. Do you have any like pain or inflammation down in the low gut?
Yes.
Yeah. So I would also do like a little bit of yarrow from time to time for your low gut.
Okay.
Yeah.
What's the application for that?
That would be internal. Like you could do like a week or two in a row, but like after 2 to 3 weeks, take a break for like a week or two, just because if you take yarrow internally for long periods of time, it will start to interfere with iron absorption. You would have to go at it for a while. You know what I mean? But rule of thumb is after about 2 to 3 weeks, give yourself at least a break of about a week. But you could honestly just treat it when it flares up a little bit. But I would keep it calm, because it makes it easier to treat, like if there is a flare up. But, yeah.
So that's 2 to 3 drops in water once a day.
Yeah. And
do that basically for a week and then take a week off.
Yeah. And then if you start to have a flare up in that part of your body, in the low gut, that's your new best friend right there. Boy, that will calm it down usually really quick. Yeah, really quick. The thing that's great about that is sometimes when the gut gets irritated, it gets inflamed, and it will.
Wait. I had said I had a low back problem.
Oh, low back.
Now I also have constipation at the same time, but I'm figuring that's other things going on.
That's probably other things. Yeah, I was looking at more of like inflammation in the low gut, low back.
Yeah.
Okay, skip what I said about the yarrow. Yeah, that's more for like low gut.
Okay.
Like the small intestine and things. Low back, sharp pain, or is it achy?
I would say usually achy, unless I do something stupid, like have to move a lot of river rock or something like that in front room.
Okay. Yeah. And so, is your work real stressful?
Not anymore.
Okay, but it has been in the past.
Yeah, it was when I was working. I'm at the senior citizen not working anymore status. So
good for you.
So I when it hurts, it's more down to the ache, kind of.
Yeah. So you could rotate probably basil, and then some sort of pain relief, like birch tar or the pain relief blend. If you don't have those, even just helichrysum.
Okay.
And rotate the application back and forth.
Okay.
After a couple of weeks of doing that, then start working in some form of pepper. And just keep rotating it out. But at first, unwind the back a little bit.
Yeah.
The pepper will increase circulation. It's still antispasmodic, but it will start to loosen the fascia up. But
Okay.
you're going back and forth between the basil and the helichrysum to kind of unwind the tension in the area, and you're doing it to flush out some of the lymph in the area. Because a lot of times when you have achiness, it's stagnant lymph, and in the low back it's going to be natural that the muscles around the spine tense up, and so the basil is going to reduce the splinting of the joint substantially. So yeah, use the basil there.
Okay. All right. And let's see, any particular pepper?
Any of the peppers will work. Pink, black, white, any of them will work. Yeah.
All righty. Good. Excellent. Thank you.
You're so welcome.
And go ahead, Deborah.
Hey, Deborah.
Hi. Good to see you.
Good to see you.
Fabiana recommended Liberation for me.
Okay.
And it's just so it's ordered and should be here, I guess, in a few days.
Okay.
But how would you, she didn't have time to explain what would be her way to use it.
Sure. Yeah, I can walk you through that. So you could use it a couple of different ways. One would just be sitting and just doing like maybe 15 to 25 just long, slow, deep breaths, right? Another way to use it is put a few drops in water and then take it internally. I wouldn't put it on the skin just because it does have some cinnamon in it and it can be a little bit irritating to the skin. And so if you were to put it on the body, I mean, it's better either inhaled or taken internally. But if you do end up wanting to put it on the body, mix it with some lotion or massage. But the best application would just be lots of long, slow, deep breaths, and then a few drops internally. And so it's very good for strengthening the body. It's very good for like infections and flus and things like that. But one of the things that it's really good for is helping you like step outside the box, like doing something different, or in times of difficulty, like say if you're in situations where, you know, you have people kind of coming at you a little bit, it can be helpful in that. You know, it makes you a little bit more thick-skinned, so to speak. And so the stepping out of the box, you know, there's a little bit of like a fear response that can happen when you start to do some sort of change or shift or doing something different. And so liberation can be very helpful for that, you know. The cinnamon and the savory in it are very strengthening to the body. The clove helps to kind of dull a little bit of the pain that can come up, you know, from stepping outside of the box. And it's not physical pain, but it can just be like you know, it helps with that a little bit. And then it also has lemon in it, which just kind of helps you flow with things.
So two questions about that. One is, till it arrives, would cinnamon be good? Because you had mentioned it helps with a thick skin.
Yeah.
Okay.
Yeah.
And when it arrives,
the other thing that cinnamon is really good for, there's a couple of things. For one, I mean, you never really think of it like this, but cinnamon is very strengthening to the heart. Like it's invigorating to the emotional heart. It's good for that. It's really good for that. And the other thing that cinnamon is really good for is esoterically is physicalizing blessings. You know, like if you're sitting in prayer or you come out of church or you're after a meditation, cinnamon helps to physicalize the blessings into the physical body and into the potential when you're taking action. And so cinnamon's very good for that.
So when I start with the liberation, is there anything that I should stop with? You know, I did the abandonment, and I also did the, well, just in general, you had told me a while ago with my issues, the heliochrysum, and then I have the tarragon and basil and helicinium that I sort of go through to.
You could still keep using those. I would use the liberation blend just right off the bat, first thing in the morning.
Okay.
Yeah.
And then anything in particular for at night to go with that? Like I had, yes, because there are days when there's the anxiety doesn't, and the mind starts to run, that's creating the anxiety, you know, they're kind of in tandem.
Yeah.
So, and then sleep is really so helpful.
Yeah.
Good sleep.
You can try using tarragon that you already have. Laying in bed, you can sit and inhale it, like, you know, 25, 30 inhalations. Hyssop might actually be very good for that as well.
Okay.
But also one of the other ones would be, you know, there's the sleep support, and it has a bunch of spikenard in it and some rue. I mean, it's got other things too, but spikenard and rue. And so one of those might be good for you as well.
Okay.
Right. Start with the tarragon. You already have it, so try that. Then do you have hyssop?
Yes.
If the tarragon doesn't work for you, then move to the hyssop. And then if not, then either go to the sleep support, spikenard, or some rue.
Okay, I have rue.
Okay, perfect. Then that should be the one after the hyssop. And just like lay in bed and just with your head on the pillow, just take some long, slow, deep breaths, or just like as you're sitting and getting ready to go to bed, do it. But the thing that I like about doing it while you're in bed is that if you start to doze off, you don't really have to get up and move around. You can just kind of conk out, and it will help you fall asleep.
Yeah. I can't really do it in bed because of my circumstances, but
okay. So maybe just go into the bathroom and do it, or you know, sit in the other room and do it, and then come in and just lay down and go to bed then.
Yeah. And one other thing, I'm having digestive problems. So and it varies what that means. Sometimes it's one thing and sometimes it's another thing. Anything just general to calm that down, or maybe using some of the things that you just talked about, the liberation and the sleeping better, that naturally take care of the other issue?
Hard to say. Like, so it just bouncing around like constipation, diarrhea, or upset, or food sensitivity. Like, give me an idea of what we're dealing with.
No constipation, but sometimes just
like loose bowel. Yeah.
That, or just extreme gas, you know, extended stomach, and those are the two things that I deal with the most.
Okay. Let me look something up here real quick. Orange oil jumps out for me, for you.
Okay.
Let me look at something else here real quick.
It's sort of an ongoing issue for me throughout my life.
So let's do this. Like a few drops of orange oil. I mean, it will be calming and soothing to your body and your system, and it will. Let me look up something here real quick.
And we're talking about a few drops, like in a little bit of water.
Yeah, exactly. Let me just look here.
that in general, things are going so well, progressively better and better.
Good. I love that.
Yes.
Good for you.
And she did a healing on my dog.
Oh, nice. Let's see. Do I know down? Mm-hmm.
She did see that I had slight lactose issues, but it was very slight.
Okay, so let's have you still do the orange. I think it's calming, but the liberation, that blend, several of the components actually would be good for the loose bowel. And so let's just stick with that for a little bit instead of having you do a whole bunch of things. I mean, you're already on a little bit of a regiment, and you got these things that are in the works, and I think they can do multiple things for you. And so let's just see how that treats you.
Fantastic.
Yeah, let's do that rather than just going and do this. I mean, I think you got a good little regiment going, and you know, we'll just augment. The orange should help with the bloating, and I mean, you can use ginger too, but I like the idea of the orange just because it's also calming and soothing, you know, and I think it could help your sleep. I think it could help, you know, just the stresses of the day and you know, things you're dealing with. I think that would be perfect. Yeah.
Great.
Yeah.
Thank you so much.
Thank
you.
You're so welcome.
Okay.
And go ahead, Sahajananda.
Hey, how are you?
Hi, I'm fine. Hi. Let me see. I am experiencing what I'm calling repetitive movement strain in my left upper arm, probably around my bicep, up to my shoulder, down to my elbow. And I'm just wondering, I know you've given a few different things you could do for different people today, but I'm just wondering what would be.
So is it bothering you like kind of like a
yeah.
You probably occipital tendonitis is actually probably what that is. And so you know, the problem is actually down like right above the crease of the arm. Like if you look, like here's the crease, and you go up a little bit higher and you poke around there, you feel like it's kind of tender or sore.
It's tender and sore all the way up.
So that is causing the tendonitis up here.
Yeah.
Yeah. And so boy, that can be a booger. Like that could be a real booger. Are you doing a lot of like stuff on it with a mouse and things?
I hate to tell you what I'm doing. I'm knitting. And
that could be a little bit aggravating. But I mean, it's from time to time, just take a stop and just stretch the arm out when you're knitting. I don't think you need to stop, but I would use. I would probably use like some forms of like pepper. Let me look something up here real quick.
I also jokingly say it's part of holding up the oils during the because I started to support my elbow because it's holding them up, but it's only on that side. So it's the inhalation strain.
Okay, so let's have you use some form of like pepper or basil or Palo Santo. Do you have any of those?
Yeah, I have, I think I have all three. I have pink pepper and pepper supreme.
Let's have you use the pepper supreme, and you could actually even like put it on like meat, like put like several drops in there and then just really rub it in that area. And then, you know, eventually put a little bit more on and then rub it more up towards the area. The spot up here, helichrysum can go a long way, you know, just even a few drops in a neat application and rub it on the sore spot. That's always good for tendonitis. You know, sometimes like in really extreme situations, like I would say this doesn't need to be addressed like right off the bat, but if it's an extreme situation, I would continue with that. You know, you can rotate between the pepper and like the basil and things like that. But one of the things that I like to do sometimes with tendons is when there's a tendon issue is Schisandra internally. And it helps to release the fascia of the tendon itself. You know, sometimes that tissue is so like dense and doesn't have the greatest blood supply. And when you wanna release fascia of an area, the way that you release it is by hydrating the fascia. You know, by hydrating the soft tissue. And sometimes in some of these situations, they get so dense that you really can't get the proper blood in the area. And Schisandra helps to moisten like mucous membranes, but it helps to moisten like fascia. And so, or it helps to hydrate the fascia. Like it helps the body convert and utilize water. Because sometimes you could be taking water in, but your body isn't using it. It's dumping some of it into the tissue. And just because it's in the tissue doesn't mean that it's hydrating that tissue. And so Schisandra helps with that process. So let's first just treat it very simply as like, you know, probably a little bit of trigger point activity that's caused some tendonitis. You know, treat that spot and then a little bit up high. And then if it's slow to heal, or if it's not really responding super well, keep doing the same regimen, but then add Schisandra to the mix.
Okay, and that just do that neat as well?
Yeah. No, that actually a good point. Like 2, 3, even 4 drops at night internally. And actually going back to Deborah, if you're not responding to some of the things we talked about for your sleep, let's have you even try Schisandra at night, right before you go to bed. But do the other things first. And then if you're still not sleeping well, do that. And so coming back to you with your thing, the Schisandra would help the tendonitis, but it would also improve sleep quality. You know, so you could take it during the day, but if you take it at night, you'll get a lot more bang for your buck. Like it will help the tendon and help you just like conk out.
I can use that too.
Yeah, who can't? Like, you know, I feel I sleep good sometimes. I still take it just to make me sleep deeper and longer.
Yeah, great. Yeah. Thank you very much.
If it doesn't respond like within the next week, bring it to my attention.
Okay.
Like it should start to change almost within a treatment or 2.
Okay, great. Thank you.
Okay, you're so welcome.
Is foundation blend the same as the foundation blend?
Yes, it's the same.
Cinnamon supreme and cinnamon leaf for being more outgoing would both work in a similar manner?
Both would work. The supreme is stronger. Yeah, both would work though. Okay, so I think we got everybody's questions, and so let's go through and do a little protocol. And we're going to do this with hyssop. So if you want to scramble around and find your hyssop, I look this up real quick. Okay, and so we're going to do a little bit of the plant empowerment with this. And what does that even mean? Like plant empowerment or teaching with plants? And so basically, we look at the idea of when you are starting to break down mental patterns within the body, within the mind, that's tied to activation of the pineal gland, or deeper would be the mental permanency, also known as the blue pearl. And so with that, when it becomes more activated, the greater the level of guidance from your higher soul, but also what starts to happen, it starts to fill your body full of light, but also starts to help you problem solve with things in the environment. And so what we mean by the plant empowerment is each plant, when inhaled, if you put your attention on different parts of the body, it's going to have a therapeutic effect, depending on where it is and how you're doing it, and sometimes what it's been sequenced with will have an impact. But each plant on its own, if you put your awareness on certain parts of the body, will activate the blue pearl, which is, again, how you process energy and information from the higher soul. And so the plant empowerment is very specific to that particular plant. Like every plant has its kind of pattern, so to speak, its imprint. And so what we're talking about when we look at the plant empowerment is these are the centers that directly increase soul contact as you inhale the plant. And it's going to be different from plant to plant. Then the teaching patterns take it to an even higher degree, that plant might be exceptionally good at shifting something in your physiology or in your mental body to a very high degree, if you go through and you follow these patterns. Right. So what we're going to do first is the plant empowerment technique itself. And so let's have you do this. Just close your eyes and notice how you feel. Think of situations you have going on in your life. Think about how you feel. Think about how you feel about yourself. Okay, you're going to let it all go. Now, begin inhaling, and your awareness is on your crown, the top of your head. Your awareness is on the front heart. Your awareness is on the back heart. And your navel. And just be still. Just let everything go. Begin inhaling again. We're going to do the same thing over. Your awareness is on the crown. You're taking long, slow, deep breaths. Your awareness is on the crown. Long, slow, deep breath. Move your awareness to the front heart. Move your awareness to the back heart. Your awareness is on the back heart. And then your awareness is on the navel. Pay attention to your body, your emotions, your mind. Pay attention to your thoughts. Just let everything go. Just be still. Begin inhaling. Your awareness is on the crown. Long, slow, deep breaths with your awareness on the crown. Just let go. Just let go for a second. Begin inhaling again. Your awareness is on the front heart. Awareness is on your front heart. You're taking long, slow, deep breaths. Just let it go. Just be still, let it incubate. Begin inhaling. Your awareness is on the back heart. And just be still, be aware, just let go. Begin inhaling. Your awareness is on the navel. Long, slow, deep breaths with your awareness on the navel. Just be still and be aware. Notice your body, your emotions. Notice your mind. Just be still. Now let's do a pattern. Begin inhaling. Your awareness is on your brain. You're still in the brain. Move your awareness to the lungs. down to the liver on the right-hand side below your ribs. Move a little bit more to the midline, slightly off to the right, still below your ribs. Your kidneys. Your spleen on the left-hand side below your ribs. Your navel. An inch and a half below your navel. The bottom of your tailbone. The bottom of your tailbone. Just long, slow, deep breaths. Just be still, be aware. Just be still. Notice your thoughts, your mind, your emotions, your body. Okay. Well, we're going to switch over to the angel stream. So I'd say let's just continue, switch over to the other stream, but we'll do more of this next week when we have time. We'll do Q&A and then a little bit of the plant empowerments. And so next week will be basil. We'll work with basil.